and just very excited to work with you at the grassroots level in North Carolina to help enfranchise our community and to bring elected leaders to hear about the issues that are at the top of mind for Indian Americans and for South Asians. I see a number of folks on the call who are national and very much great supporters of the project of Impact. We were founded 4 years ago and really have experienced kind of exponential growth. So lucky to have a great presence in North Carolina and to hear from our leaders. And thank you, Jay. I see he joined. I'm excited to hear from you and to hear about what's happening both at the local level and at the federal level with what we can do to help not just solve COVID at home. And we're getting to the point where we can now, meet in person, where we can now see each other again. But the pandemic is not over until we vaccinate the world. And we've seen the devastation in India. And we, in particular, as a community, recognize that. And I think that's really the point of bringing us together today, is to talk to our leaders about, how do we organize locally, nationally, so that we can act globally on this issue. But I'll turn it back to Sarah, who's our Director of Community Engagement, who put this together, and very excited to hear everyone who has to speak tonight.
Thank you so much, Neil. And thank you everyone for joining us. It's good to be with you all from Durham. So like Neil said, tonight we're going to hear from several policy experts and elected leaders representing the triangle who care very deeply, like we all do, about the COVID crisis in India, South Asia, and the world. I do want to acknowledge before we begin that many of you on this call may have recently lost someone, family members or friends to COVID abroad. And so we extend our sympathies, condolences, and commitment to ensuring that we're continuing to advocate for global vaccine equity. I also want to thank Impact's board, Deepak Raj, for his leadership on this issue. And again, as Neil mentioned, our co-host for tonight's event, and Cat in Action. A couple of quick logistics items, and then we'll introduce our first speaker. Everyone, we're going to ask you that you stay on mute for now, but please use the chat box to share questions, comments, reactions. We will make sure we have a Q&A portion at the end of this event in which we could elevate questions for any of our speakers tonight. So with that, I'm going to introduce our first guest of the evening to provide an update on the situation in India and the global vaccination crisis. So Dr. Krishna Udayakumar is the founding director of the Duke Global Health Innovation Center and also the executive director of Innovations in Healthcare, which curates and scales the impact of transformative health solutions globally. Born in Bangalore, Dr. Udayakumar has been a leading expert on this spring's COVID surge in India and the world and global vaccine distribution and equity. He's been widely quoted and interviewed by national and international media outlets and has advised the Biden administration on how to bring this pandemic to an end. So welcome, Dr. Udayakumar. We look forward to hearing your update.
Great. Thank you so much, Sarah. It's such a pleasure to join you and the co-hosts, as well as the distinguished guests that are joining us today. I want to take just a couple of minutes and bring us up to date on the situation in India, as well as the implications of that situation for the world, and hopefully leave you with some thoughts on why we should see the global challenge not just as a humanitarian issue, but also as a national security imperative. Globally, we're at a really dangerous moment in this pandemic. We have over 174 million cases, 3.7 million deaths. And what we've seen in countries around the world, most graphically in India, but also in places like Brazil, and now starting to expand across parts of South Asia, Southeast Asia, is this terrible humanitarian crisis that's unfolding over the past few weeks to months. The very large second wave that we have seen hit India has peaked, thankfully, in mid-May, but with more than 400,000 cases a day and daily deaths that peaked in late May of more than 4,500 deaths a day. That's brought India to have the second most recorded cases of any country around the world, 29 million cases, and the third most reported deaths, more than 350,000. But it's even worse than that, because we know that both of those numbers are severely undercounted, and most estimates of deaths say that it's at least 1 million, perhaps as many as 2 million deaths in India over the past few months. We've seen terrible images of people searching for hospital beds, dying because of lack of oxygen, basic supplies, medications, a lack of testing. So this really has been a collapse of many health systems around India. The numbers are getting better, but they are by no means going away. We're still seeing 100,000 new cases a day and more than 2,000 deaths a day, and that's just what's reported. And the crisis is worsening because it's moving from large urban centers to rural parts of India that are even less prepared to deal with the situation. We've all witnessed and experienced in many cases the massive disruption to daily lives with deaths, with illness. And we've also seen a lack of access to basic care, as well as the economic hits that have come from the devastation of the pandemic and the lockdowns and other measures that have been necessary. And as we've seen with other situations around the world, this has also led to and spawned dangerous variants, what's now being called the Delta variant, the B1617, that was originally seen in India as definitely more transmissible and perhaps causes more severe disease. It's now been found in more than 60 countries, including here in the US, where it's 6% of all cases. And Dr. Fauci warned today in testimony that we have to accelerate our pace of vaccinations in the US before the Delta variant becomes dominant here. So we know that vaccines really do provide the exit ramp from the acute phase of this pandemic. But the global situation with vaccines is also terrible. We're witnessing inequities unfold all over the world. 2 billion vaccinations have been administered so far around the world, which is enough to vaccinate about 12% of the global population with at least one shot. In the US, we're grateful and should be celebrating that we've hit more than 50% of everyone in the US that's been vaccinated. In India, that's only 13% and about 4% of people that have been fully vaccinated. But we shouldn't forget that across the entire continent of Africa, only 2% of the population has received even a single dose of vaccine. India traditionally has been a powerhouse of manufacturing for vaccines, and going into this pandemic, it still was. And what we have seen with the growth in terms of cases in India means that the vaccines in India have been used entirely for domestic purposes for the last few weeks. And that's had global repercussions because the COVAX mechanism, which is providing vaccines to the 90 poorest countries in the world, was relying largely on supplies from India to make that happen. So there are hundreds of millions of vaccines that are now not going to other poor countries in the world because of what's happening here. And what we see over and over is that the pandemic is about health, it's about lives as well as the economy. And moving forward, US leadership is really going to be critical to making this better. President Biden has stepped up and stated that the US will lead. He's called the US being the arsenal of vaccines. We've seen some positive steps with a $4 billion commitment to COVAX, and we've seen the donation noted of 80 million doses by the end of this month. Those are all very good steps, but nowhere near what we actually need to deal with the scope and the scale of the global pandemic. We have called for much stronger leadership as well as a clear, cohesive strategy coming from the White House. We have got to share more vaccines more quickly, and we also have to figure out how to continue to work on supply because vaccine supply will be the global constraint for the next 6 to 9 months, after which we really also have to work on generating demand and dealing with delivery systems for vaccines. The G7 Leader Summit is coming up at the end of this week, and that is another critical moment that could be an inflection point that gets us closer to ending this pandemic. We have called for the G7 to make a commitment to share at least 1 billion doses and as much as 2 billion doses of vaccine by the end of this year, and make sure that every country can reach 60% vaccination by the end of next year. That's possible if we step up and act together. So we've heard over the course of the pandemic that no one is safe until everyone is safe. What we've seen happen in India and all over the world have viscerally proven to us that that's the case. And we have much that we can do as a community and that we can urge our leaders across the US to help lead the world out of this pandemic. Thank you for the opportunity to share these evidence and these thoughts today. I look forward to the discussion.
Thank you so much, Dr. Udayakumar. We really appreciate all of your advocacy and the update you just shared. Our next guest couldn't join us in person today, but was kind enough to share a video greeting. And that is our very own here in the Triangle, Morrisville Town Council member, Satish Garimella.
Good evening, everyone. A big thank you to the Indian Impact for hosting the NC Town Hall. My name is Satish Garimella. I serve as an at-large council member for the town of Morrisville. Due to my council meeting today, I'm not able to join you in person. I would like to send my greetings and thank all of the elected officials for joining us this evening, especially Congressman David Price and Congresswoman Deborah Ross. The COVID crisis in India and across the globe has exposed so many iniquities that for many of us, we have seen a split screen reality where the families and friends in the US have been able to reunite, while our families in India and across the globe have suffered the worst COVID surges to date. I'm grateful to you all for here to keep the spotlight on this important issue. The United States must lead the global effort to send vaccines to India and other countries across the globe. Stay safe, stay healthy, and I hope we can meet in person soon. Thank you.
Great. And this next guest, I'm thrilled to introduce, as she is my very own county commissioner and dear friend. Nida Allam was elected this past year to her first term on Durham's County Commission, where she has been fighting for a better Durham. Commissioner Allam is also the first Muslim American woman to be elected office in North Carolina. So welcome, Nida, and thanks for everything you're doing to support our efforts.
Thank you so much, Sarah, and thank you, Impact, for organizing this event and inviting me to speak. I think it's so important for all of us to be here, and also thank you to our members of Congress for joining us, because for me as a South Asian American, a large portion of our community here is first or second generation immigrants. So a lot of our family members are still overseas in India being impacted by this pandemic every single day. So I wanted to, take a more personal approach to this conversation today to share, experiences of my own family members who are in Hyderabad right now. I unfortunately lost 2 family members within a week of each other in Hyderabad because of the poor hospital quality and the poor access to ventilators. My aunt, my uncle, and my cousin were all 3 hospitalized and split across multiple hospitals because there was not enough capacity for them to be together. And while they were in their stay, they didn't have any proper ventilators. My aunt actually, in her last moments of consciousness, was begging the doctors to take her oxygen mask off because it was just blowing hot air into her face and it didn't fit on her face properly. So they were stuffing the mask with cotton to try to keep the gaps closed. And that is the poor quality of what the patients are suffering through in the hospitals. And unfortunately, when my aunt passed away, because she was split from her husband and her son in different hospitals, they weren't informed of her passing, and because of their condition of their own mental stability of being in and out of consciousness from their low oxygen levels, they weren't told. Before my uncle passed, he did not know that his wife had passed away. And my cousin was just discharged from the hospital about a week ago, and he has a 1-year-old child that thankfully did not contract the virus and was able to quarantine at home with his mom. And he found out that his mom and dad passed away when he got home. And his brother, who actually lives here in Durham, North Carolina, near us, he was vaccinated, thankfully, while he was here. And he was able to travel back home, but wasn't able to be there with his mom during her final moments. But is able now to be there for his brother and traveling back and forth from different pharmacies trying to find medication, because even though his brother is home, he's still suffering from the after effects of being in poor conditions in the hospital, not having a proper ventilator, and still suffering from COVID side effects. And it's imperative for us as the United States, as one of the strongest nations in the world, who's vaccinating at really high rates. And I'm so proud that we're able to get so many of our US citizens and residents vaccinated, but it's imperative for us to also be looking at people across the world because this is a humanitarian crisis. These are family members and friends of United States residents who are suffering. And we have a moral responsibility to be sharing vaccinations, to be providing support with receiving more oxygen tanks and providing support with even just regular masks and hospital equipment. So I'm really thankful that our members of Congress are here who are advocating on our behalf and on the South Asian American community's behalf to provide better quality and better support to the Indian community. Thank you.
Oh, thank you so much, Netha, for sharing that heartbreaking story. And I know tragically, it is one that many of us in the diaspora here can relate to. So thank you for sharing, and so sorry your family is having to navigate that. And we appreciate your leadership as well as the leadership of all of our elected officials on this call, and everything that they are doing to ensure that the United States remains a global leader in this space. Our next speaker is the first Indian American and the first South Asian elected to the North Carolina General Assembly, State Senator Jay Chaudhuri. Senator Chaudhuri currently serves as the Senate Democratic Whip, where he's the second ranking member of the caucus. I know many of you know him well. He serves on multiple committees, including the Appropriations Committee and Rules Committee. Senator, I'll pass the Zoom mic to you.
Thank you, Sarah. Thank you, Ian. Thank you, Neil, for your leadership with Impact and the amazing impact that you all have had for the Indian American community for the last few years. And it's great to be with Commissioner Allam, as well as Congressman David Price and Congresswoman Deborah Ross, who are just incredible advocates for the Indian American community. And I really cannot think of two better members of Congress to represent our community. And thank you to the North Carolina Asian American Together folks here as well. So Sarah, as you said correctly, it's wonderful to be on the call with so many great folks tonight, but it's really unfortunate circumstances that bring us together. As Commissioner Allam talked about with her extended family, we've all experienced, I think, the same stories of those who live back in India. I've had also loved ones and extended family members that have been impacted by COVID and that have and passed away. And as we really heard from Dr. Udayakumar, the outbreak in India has been ferocious. In fact, after the pandemic broke, I spent almost 6 months trying to get my own parents back from India because they had difficulties returning back, being stuck in Calcutta, and just only returned back in December of last year. I'm certainly optimistic that we're on our way to protecting North Carolinians here. So I really think now is the time for us to really talk about how we can help the rest of the world, including India. And without a major course correction, frankly, we're going to have to wait until 2023 or later for a large-scale vaccination to help the rest of the world, including India. And from a personal level, I think that's something that's going to be very, very difficult for Indian Americans to confront, not only with the humanitarian crisis, but the fact that for those of us who have parents, they're not going to be able to go back to India anytime soon. And for the fact that, we, Sejal, my wife, and I take our 2 young children back to India every few years, that may not be an option as well. And so, I'll say 2 things about what is going on. I mean, one is, and I think we'll hear from Impact, the incredible leadership that Impact has exhibited in trying to push the Biden-Harris administration to make sure that we get those vaccines to India. But also the other conversation that hasn't really garnered as much attention is really some of the efforts that is happening at the state level to try to focus on getting additional personal protective equipment to India. So, I think as we will hear from both Congressman Price and Congressman Ross, the vaccines are a decision that has to be made at the federal level, but there are other opportunities to provide help that are outside of the vaccines. And I have been in conversation both with the folks in the state of North Carolina, with Governor Cooper, given the fact that 1, we have a large Indian American community, but 2, we have a lot of Indian companies that have economic ties here to North Carolina. So I'm going to continue to have those conversations to see if there are ways that we can provide additional personal protective equipment back to India. If there are other ideas that folks here have, please let me know. I think that there may be other avenues, but again, I really appreciate Impact's effort in leading the charge. I really think that I think this is a critical moment for the Indian American community. I think this is a critical moment for United States-India relations. We've got to try to do everything we can to try to help the rest of the world. So, but thanks again, Neil and Impact, for hosting tonight's event.
Thank you so much, Senator Chaudhuri, and really grateful for your leadership and everything you are doing at the state level. The ideas you mentioned in terms of having the state look into sharing, PPE and working with the private sector to do that is I know a welcome piece of news and an update. So thanks again for joining us and your leadership. We're now going to pivot to our congressional leaders. And so I'm going to introduce our first panelist. Each of our two congressional representatives will have a few minutes to speak. We'll have a question and then open it up for Q&A. So I'm seeing a lot of great discussion in the chat box. As a reminder, if you've got a question, feel free to drop it there. If we don't answer it in the chat box, we'll try to lift it up during the Q&A portion. But our first panelist for this evening is David Price. Representative David Price has represented North Carolina for decades. He is my congressman, and I could not be more proud to have him serve me. Currently, his district includes Durham, Franklin, Granville, and Orange counties, as well as parts of Chatham, Wake, and Vance, which means he has quite a bit of ground to cover when driving across the district. Before serving in Congress, Representative Price was a professor of political science and public policy at Duke University. He currently serves as the chairman of the Transportation, Housing, and Urban Development Appropriations Subcommittee, among other committees. Thank you for joining us, Congressman Price.
Thank you very much, and thank you for putting on this event. I appreciate the work of the Impact organization, which is really getting out the word about the pandemic and its particularly brutal impact on India. The NCAAT organization, others that have gone into organizing this event tonight. I'm very appreciative. It was appropriate to hear first from Dr. Udayakumar with the grim statistics. I think the high point was on May 6th, when there was an incredible 412,000 new cases in a single day. And we know that estimate of 350,000 deaths is a low estimate, as he explained, because of the likely underreporting. This is an utter disaster for the people of India and for the Indian community worldwide. And for those of us who have friends and associates in that community, we've all heard the stories. Commissioner Allam, very generous to share her personal story that has been repeated so many times in this area. And I mean, I think just in terms of talking to people and people who have had a direct impact, I believe talking to Indian American residents of the Triangle, there's much more of an impact than in just talking with the general American community. We've had, of course, more deaths nationally, but the impact on the community and the relative impact that people feel, I think, is the greatest of any community I'm aware of. So we of course reach out in sympathy and solidarity. And the good thing about the Impact organization is that you've pointed the way forward to some very specific things that our country can do. And as an elected official, I am very, very mindful of this. We've been exploring what we can do and how we can do more. And we know that this requires us to do more, much more than we've done so far, although we've made an initial effort. It shouldn't have to be said over and over, but I guess it does, that None of us are safe until the whole world is safe. And if your humanitarian impulses, if people's humanitarian impulses are not sufficient to trigger action, then maybe self-interest will be, because the more cases are multiplying, the more variants there will be, the more dangerous variants, more transmissible, more lethal. And it's just this is no time for America first or any other country alone and on its own. This is a time for international solidarity and common effort. And that's simply what we have to try to spearhead in this country. I do think the Biden administration is inclined to do that. We've had hearings this week in our State and Foreign Operations Appropriations Subcommittee, where there's certainly an inclination to do that. So now the challenge is to mobilize and get the vaccines worldwide in quantities that are, of course, unprecedented, but nonetheless are necessary to do the job. The early efforts by the Biden administration did aim at those horrible stories that we heard, and we've heard again tonight, of a lack of oxygen, a lack of ventilators, a lack of just basic equipment, PPE, lack of tests, and so there was a crash program to get those things to India in early May. The emphasis now, of course, is on vaccination. We've recently announced the release of 80 million vaccines. The plan, as I understand it, is for India to get 7 million of those through the COVAX program, this international program to make vaccines available, and India is to get 6 million more directly. Of course, that's just a start, but it's ironic. India has some of the most sophisticated vaccine manufacturing facilities in the world, and India very generously early on shared that capacity with the rest of the world. And so now the rest of the world needs to stand up for India. And the probably the most important way to do that is to just ramp up this vaccine production to an incredible level and make sure that gets to India just as rapidly as possible. And also that within India, that the vaccinations are applied to people in all walks of life. I share the doctor's hope that out of the G7 meetings this week will come renewed commitments on the part of the world's industrialized countries that I think is on the docket, and we are hopeful about that. But there's more we need to be done, and the Impact Organization has helped us understand that. Also helped us understand the human impact through organizing meetings like this one, and making sure that the Indian community, the plight, the need is communicated very, very widely. So I'm grateful for that. Grateful to join you tonight, and look forward to the discussion.
Thank you so much, Congressman Price. I know we have been working at Impact very closely with our congressional leaders, such as yourself, and so cannot thank you enough for advocating on our behalf, on our community's behalf. I know several leaders in Congress have also been working with the Biden administration closely and to pass different pieces of legislation, like the NOVID Act, that would authorize funding to ramp up vaccine production, as you mentioned. I'm now going to introduce the Triangle's newest congressional representative, Congresswoman Deborah Ross, who was first elected to the United States House in 2020. She represents the 2nd Congressional District in North Carolina, so I know that's many of you on the call, as her district covers most of Wake County. In the House, Representative Ross serves on the House Judiciary Committee, House Rules Committee, and House Committee on Science, Space, and Technology. She's also on the House Caucus on India and Indian Americans. Deborah Ross has dedicated her entire career to public service, and prior to serving in Congress, she served, as many of you know, in the North Carolina House of Representatives and as a civil rights lawyer fighting for fairness and justice. So welcome, Congresswoman Ross.
Well, I'm delighted to be with you during this unfortunate time. And So many things that I was going to say have been said, so I'll make my remarks relatively brief. But the first thing I want to say to you is that I know that so many of you have relatives in India who are in danger, and they do not have the resources that we have here in the United States. And while I'm on the Science, Space, and Technology Committee, and we're talking about vaccine hesitancy when we're at 50% plus, and we're dealing with people who are vaccine hesitant for political reasons, in India, there's a dire need. And we understand that you're here and that you are that vital link back to your families, back to a country that's one of the most populous in the world. And I want you to bring us information, because we cannot always just rely on the government. We need to rely on our constituents to tell us what's happening on the ground. And I want you to know that both Congressman Price and I care very, very deeply about the pain that you have felt during this horrible, horrible situation. We felt it here in the United States a year ago. You're feeling it even more acutely today. I am part of the India caucus. The India caucus has written letters to the Biden administration. I've written letters to the Biden administration, but nothing can seen out. One thing I think that is very helpful is that the Biden administration is taking this seriously. They appreciate what India has done for us. They are willing to do whatever they can for India. I don't know how quickly some of these things like the patent issues are going to be deployed. So what we really need to do is get the vaccines that people can use as quickly as possible to them. And not necessarily, it might not be the Pfizer vaccine where it has to be cold. Let's just get everything to India as fast as we can. I want to hear from you a little bit later on about how you think the Indian government has been responding, because we've heard mixed messages about that. And we want to be able to work as closely as possible with the government, but also with NGOs that might be able to deliver things to people much more directly. I want you to know from the very beginning, I am with you 150%. My staff is focused on this, but we need to hear from you, because sometimes we don't hear everything, the way it's really on the ground. We need to hear from you what you need so that we can advocate for you. So thank you very much, and I'm looking forward to your questions.
Thank you so much, Congresswoman Ross, for your leadership, and that was a perfect segue. I'll ask one question and then want to open it up for Q&A. So if you haven't already put your question in the chat box, please do so. We want to make sure that we get to as many of them as possible for our distinguished guests. But for Congressman Price and Congresswoman Ross, I know many people join this call because they are concerned about not just India, but global vaccine equity across the world and other issues. So what advice do you have for our attendees on how they can best support COVID relief efforts abroad and engage with offices of their elected leaders at all levels?
Well, I'm glad you put it the way you did, because that is the way to understand this. This is a worldwide pandemic, and worldwide vaccination is the only answer, the only way to get us to the other side of this. And while India, of course, is an acute and tragic and huge case, the case is more universal. We're a generous country, I think. We certainly like to think of ourselves that way. But I have to tell you, it was a struggle in the CARES Act and in the other legislation that we passed last year. It was a struggle to make room for COVAX. and for an international vaccination effort. It did get done. It did get done, but it was very disappointing to see how many people put this way on the back burner in terms of priority. I think with the news we now get from India and other places, maybe there's more awareness, but certainly with the advent of the new administration, and I'd say a new attitude about many things, that it's less of a struggle now to get this incorporated and maybe we just have more understanding now that this is truly an international crisis. But as Deborah Ross said, and as I would underscore, this is not an adequate effort at this moment. This has to be stepped up. It has to be continued, intensified. It has to be internationalized. The G7 and more need to be fully on board with this. We've never, ever had an international health challenge like this. So you ask what people can do. I think meetings like this help. I think kind of multiply the effort many times over. It's a matter of awareness and of political insistence, that this has to be tended to, and that the international aspect of this has to be tended to. No thought of chauvinism or America first or that kind of stuff when it comes to this. There simply has to be an international emphasis. We have to insist on it.
And I'll add a couple of things. From everything that I've heard, the most important thing is to have the funding for the vaccines and for the other PPEs and whatever we need. And we learn this, through hunger. Don't send things, send the funding to the people who know the right thing to do, because then they will be able to deploy those resources. The other thing that I have learned, very early on the Science, Space, and Technology Committee, we had a hearing on vaccine hesitancy. And, in the United States, the initial word was that was going to be in communities of color. Well, what we learned in this Science, Space, and Technology Committee was vaccine hesitancy is just as great in rural communities, in pro-Trump communities, wherever it is. And so the bottom line is we have got to make the vaccine available to people in a way that they will take it, and the vaccine that's most appropriate to them. So I mentioned this briefly. I mean, really, most of the vaccines here are still in their emergency approval phases, right? And then you've got the Pfizer vaccine that has to be in dry ice, and it's complicated. And so what we need to do is get the maximum number of people vaccinated with whatever vaccine can get to them in a way that they feel comfortable. And they feel comfortable for their parents, grandparents, and children. And that is not a small feat. It's not like you just give people vaccines and everybody's happy. I mean, even here in the United States, we have people who are not taking the vaccines. So we've got to be smart about how we do that. I actually think that North Carolina is somewhat of a model for doing it, because we're a rural state. We've got all of this stuff that's going on, but we've been better at deploying the vaccines. And so to the extent we can share that globally, I think that that's very important.
I should add just a word about nonprofits and the work that's going on a charitable basis. There is a lot of that going on. And I know that the NCAAT organization, Mr. Mandevali and others in the leadership of that organization have done a good job of getting word around the triangle about what those organizations are and how concerned people can contribute. I really think it's important to do that. We, Deborah and I are limited as members of Congress in the advocacy we can directly do for even for the best organizations. I think it's a silly rule, but it is. it is the rule. So we can't necessarily advertise for these nonprofits, but you should. And I do think it's helpful to have information out in the community, the Indian community, but beyond, as to how concerned people can help.
Thank you so much to both of you. And yes, we encourage those of you, I think some of this is already happening in the chat box, but if you've got NGOs you'd like to recommend, feel free to put them in the chat. I'll also share that Impact is part of a larger coalition that has been advocating on this front for many weeks now. So if you have not visited our website, sendindiavaccines.org, please do so. We've got options for you to sign a petition and also to, find organizations to donate to. I'm going to now open it up for Q&A. So we're going to try to get to as many of these questions as possible, but do want to flag with the time, we might not get to all of them, but we'll be sure to send them to our special guest offices. Our first question comes from Rahul Krishnaswamy, and it's asking which part of the vaccine supply chain would be the most conducive for the United States to support Indian vaccine production? And how would we overcome any intellectual property related issues?
I don't
Maybe
mind
the doctor,
taking this.
Go ahead. If Deborah can do that, I also think
I'll talk about it just a little bit. So I've been reading about this and also hearing about it. I serve on the Judiciary Subcommittee on Intellectual Property. And from what I've been hearing most recently today is that some of the disputes with the WHO and the EU are going to delay anything that deals with intellectual property, and that the better thing to do is to just send supply now, because we can't wait 2 or 3 or 6 months for the disputes over intellectual property to be resolved. They may be resolved and they may be able to help with later variants of the vaccine, but what we need to do is just get as much vaccine out as quickly as possible as that whole intellectual property issue plays out.
Yeah, well, that's my understanding as well. I do think it's true that India, given its capacity, its manufacturing capacity, India is a country where the patent relaxation could have greater impact than lots of other places. But I still think what Representative Ross says is correct. This is a crash program. Just get the vaccines out worldwide, ramp it up as fast as we can, and get them distributed as well as we can. I wonder if Dr. Udayakumar could respond to this, just the technical aspects of this.
Sure, very happy to, and agree with Congressman Ross and Congressman Price. It really is about urgency. In the short term, what we are really dealing with is trying to optimize supply chains. So we're dealing with everything from bioreactor bags, filters, things. So it was a positive sign when the Biden administration last week released the Defense Production Act hold on the Novavax and the AstraZeneca vaccines, which allowed supply manufacturers to send those wherever they thought they could be best used. Now, one of the things that the US administration has done really well over the last few months is through Operation Warp Speed, and what it's become in the White House through the task force is really to work with every manufacturer of supplies and of the vaccines to make sure that they are helping to optimize, and when they've run into problems, to twist arms when it's needed to happen, to make sure that people are stepping up, which is why you're starting to see deals like Merck step up to manufacture Johnson & Johnson vaccine to do the right thing. If we can extend that beyond the US to bring in our allies, to bring in India, and start to optimize those supply chains, we can really ramp up the vaccine manufacturing. And we've projected just this week, if that's possible, we could get 7 billion doses of high quality vaccine out to people this year, and twice as many next year. And Congressman Ross is exactly right that the IP issues at the World Trade Organization are going to be contentious, just because it's a consensus-based organization. That's going to likely take 6 months to get to some resolution. And what we've seen from Germany and from the EU is, if not opposition, then skepticism. So I don't think that we're actually going to get to a place where IP waivers are going to happen, frankly. So we need to think about every pathway possible, both in the short term and in the long term, to make sure we're ramping up manufacturing capacity.
Thank you all, and thank you for the great question. Our next question, and Senator Chaudhuri might loop you in if you also have thoughts on this one, but Bharat is asking about essentially, states and surplus vaccines, and if how states can potentially share vaccines with the world, but the legal ramifications of that. So would love any thoughts from any of our speakers tonight on, are there conversations around states' surpluses of vaccines and being able to share those with the world?
Yeah, Sarah, as I mentioned, I appreciate the question from Bharat, and again, we'll defer back to Impact and the members of Congress, but the vaccine decisions is a sole decision that has to be made by the Biden administration. I mean, Bharat is absolutely correct that there are surplus vaccines that each state may have, but that decision ultimately cannot be made by the governor of the state. I mean, the federal government has to make that decision. But that being said, we know that governors in other states have tried to pick up the slack, which may not fall into the vaccine category. So we've seen efforts in Indiana, for example, where the governor of Indiana has worked with businesses there that have ties to India to send personal protective equipment over to India, and we're hoping that we can facilitate and do the same thing here in North Carolina. And Sarah, I think I was apprised through Impact that I think there may have been similar efforts, kind of private business to business efforts that may have been done in New York as well.
Also getting a question about, generally, what would it take for us to go on a war footing and treat the crisis like we did the world wars, right? Where we can bring our enormous economy to come to bear to become the global white knight. So any thoughts on how we, become this global white knight and really take this issue head on?
I mean, Sarah, I'm just going to chime in here because I think this kind of underscores the importance of Impact and the work that you all are doing. But we can only go on a war footing on addressing the global vaccine crisis only if folks on this call decide that they can share the urgency and the importance of making sure the rest of the world gets vaccinated. I mean, I think as Dr. Udayakumar said, I mean, getting us vaccinated alone is not enough. Number one, because we see the variant is already making its way into the U.S. And, I mean, I think the good news is it looks like the vaccine is still working, but I know that the numbers are quite high in the United Kingdom already. I mean, I think there was an article that just came out in the Washington Post about that. So, I mean, there's a public health argument, but there's also a humanitarian argument too. But I mean, I think that the efforts that Impact has been focusing on to try to make sure that this gets the administration's attention is something that we should all be talking to our neighbors and friends about.
Yeah, and I'll let Congressman Price talk a little bit more about this because he has much more experience. But, what I've seen during this pandemic is, I represent the triangle where people recognize what is really going on with the coronavirus and have those international connections. And the problem with us being the white knight isn't that we don't have the capacity. The problem is that we're a divided country and we don't necessarily have the will. And there are people who we are serving with who are still, trying to have a fight about where the coronavirus came from and make that the issue rather than solving the problem, and not really caring about their neighbors. I mean, even not getting vaccinated themselves here in the United States. We are very, very, very fortunate that we are giving out free vaccines and so many people have gotten them. But there is a segment of this population that's not vaccine hesitant because they are unaware. It's because they're in denial. And so in order to be the white knight, you need to have that coalition of the willing that not only wants to take care of ourselves, but wants to take care of others.
I do think the analogy of a wartime footing is apt. I'm not expert either on the Defense Production Act and the kind of ultimate capacity our government might have to commandeer vaccine production and and there are real questions. I'm sure there are going to be major questions as to what would be the costs of that in terms of diverting other kinds of medicines that are needed and so on. It's a huge challenge, and of course, what Deborah says is true as well. Just getting the political support behind something like this is a challenge, but it is a matter for leadership to chart the way and to challenge all of us. And I do believe that this kind of wartime footing and just an incredible increase in production of product around the industrialized world is really what the moment calls for.
Yeah, if I could add just a couple of points, totally agree with what's been said. In some ways, part of what may help unite what's been noted are these divisions is really perhaps thinking about this as industrial policy, where we saw action even today from the Senate, that in 3 to 5 years, we are going to see a different world where there will be distributed manufacturing capacity with more plants in Africa, in Latin America, and the like. That's just going to happen. That's got to be one of the learnings from the pandemic. And to prepare for the next one, I think the question for us is really, is it going to be the US, the G7, the world's leading democracies that help to develop that global industrial policy? And is it going to be the public-private partnership model from the US that's going to lead the way for what the future of biomedical innovation can look like for the rest of the world? That's something I think we can get a lot of people behind to really lead the way. Two, just one other point to make is that we really are struggling with supply this week, this month, through the end of this year. But like in January, February, March of this year in the US, where we thought, supply is going to take a long time, and many of us were surprised that by April, the inflection point was already here, where we had more supply than demand. We expect that's actually going to happen by the end of this year in almost every country around the world. So we shouldn't forget how much we have to invest in the delivery capacity to make sure we can distribute the vaccine, deal with all the misinformation that's evident, not just in our country, but almost every country now. So making sure we're investing now in the capacity to get vaccines in arms and make them vaccinations is going to be just as important if we're going to turn the corner in the next year.
This is all incredible, and I wish we had a lot more time to get through everyone's questions. I know there are so many, and just to let everyone know, we are saving them all, and I'll be sending out a follow-up email. But we are going to wrap as we want to be respectful of time. So I hope each of you will join me, in silently or use the clap reactions in thanking our distinguished guests. And we also want to thank you on behalf of Impact for joining this call. I know Manisha asked a great question, what can we do? Are there actionable items? So Ian, if you wouldn't mind sharing our closing slide, on behalf of Impact, as well as several other organizations, including, In Diaspora, the National Sick Campaign, SOLDEF, so many others. We have launched a Send In Your Vaccines campaign, and if you visit our website, sendinyourvaccines.org, there are action items for you all to sign a petition, as we are in daily conversations with the White House, with our congressional leaders, and we are sending out updates to keep you all informed about what is happening and to make sure that we're continuing to elevate this issue. So please join us if you haven't already. And again, if you go to the next slide, Ian, also want to thank our partners for this event, NCAT in Action. So North Carolina Asian Americans Together has been leading the way on supporting Asian American advocacy in North Carolina for years now. And so here are a few links. Feel free, Ricky, if you are on, to drop those in the chat. But if you are not already familiar with NCAT and NCAT in Action, please continue to follow them. They are fantastic allies in this space. And we are going to wrap. So thank you all again for joining us. Much more to come tomorrow and a follow-up email. Really appreciate all of our distinguished guests and everyone for joining this call.